Hey, I'm Dr. David Mason. I am a chiropractor in private practice going on 16 years now. And our practice is in Franklin, Tennessee. It's Mason Chiropractic Health and Wellness. Chiropractic care involves focusing on looking at the spine and misalignments that can involve the joints of the spine and or muscles or ligaments or disc and the nervous system. So yeah, that's the treatment is called chiropractic adjustments, and we make adjustments as needed and help people get out of pain, help them with their posture, and help them just have a hopefully a better functioning spine and life. So it's fun, actually. It's really fun. I went to Indiana University. I was in college for 4 years. I got an undergraduate degree in biology, Bachelor of Science. And then I went on to graduate school, chiropractic school, if you will, which is another right at 4 years. It's 3.75 with no break. So we round up to four. So essentially 8 years to get to become a doctor. I chose to start my own practice back in 2005. And a lot of friends of mine or folks coming out now, I know like it's that's the option. It's like go in as an associate or come in and kind of start your own practice. So I started my own practice back in '05. So I am one of the chiropractors that didn't unfortunately didn't have experience going to a chiropractor as a young kid or as an adolescent. And I was a junior in undergrad college, and I was still trying to figure out what I wanted to be when I grew up. So I was in the middle of a particular class. We had this ability to go out and pursue internships and kind of shadow preceptorships with different things that we thought we wanted to be, right? So I went in and shadowed a surgeon, an anesthesiologist. I shadowed someone else in a hospital. And the hospital environment just, the good thing for me is like going in and shadowing. It helped me weed out some things that I knew I didn't want to be. So I would advise that for any young folks out there that are thinking about certain things. Shadowing was, for me, it was a good thing. Then I went and shadowed a dentist and then an orthodontist, and I had a list. I was going down the list, and it was like, no, no, no. So one of my family members back in Indiana was, which was where I grew up. My aunt actually was seeing a chiropractor. And she's like, "Why don't you go shadow my chiropractor?" He's shadowing all these other doctors, and I knew I was drawn to helping people and serving people, and hopefully being a doctor of some sort. And I was trying to carve out what that looked like. And as I shadowed this chiropractor for a few days, and then of course I'm a researcher, so I went home and researched like what is this all about. And the more I dove into it and looked and researched, it just kind of fit my personality. Like I like helping people um, in a more holistic way if possible without drugs and surgery. There is absolutely a time for drugs and surgery, and we refer that out to medical doctors in Western medicine. But I really love the approach that chiropractic allows us to help people from the inside out without drugs or surgery. So that's it in a nutshell. Typical work day is get to the office, typically with a cup of coffee, and my staff has my day prepared for me. I have a full schedule, typically every day, Monday through Friday, and I see patients. I get to know new patients typically every day that come in with some sort of musculoskeletal complaint, an ache or pain, and we try to qualify if we can help that or not in a kind of a natural, holistic, conservative way. And if we can help them, then we get them on a treatment plan to take care of their said ailment. What I love most about my day-to-day work is seeing the results of people. Just bring smiles to people that are in pain originally, and they're hurting, or they can't play with their kids or their grandkids. And typically, that's something we help them change. Like I call it life effect. I always want to know, like when they're coming in the door, like, hey, like I understand you're in pain. We want to try to help that, but let's dig a little deeper. And is that affecting something in your life, like your sleep, your work, your hobbies, are preventing you from doing a goal or something you enjoy doing? And I usually like to jot some of those things down if they can. They typically can recall quite a few right off the bat. And when those life effects start happening and they start getting their life back, that's a win-win. They're happy, I'm happy, and it's really like a high five celebration, right? So it's fun. It's cool. I would say, looking back at school, I've always been drawn to the science part, right? And there's different sciences, of course. You got your biologies and your chemistries and your physics and things. I was always drawn to biology and just kind of nature and being outside, growing up hunting and fishing and just hiking and being out on the lake. I just love being outside. But and biology was just a natural way for me to pursue the sciences that I knew I needed as prerequisites. But I was also very into art and being creative and having an outlet to draw and paint and create music. All the arts have always been a big part of my schooling, if you will. And looking back on that, it really plays into my profession because chiropractic, in my opinion, it's an equal branch of being rooted in science, but also being creative and artistic in kind of like how you treat a patient or how you deliver your treatment. There's really an art to it. You can go to 20 different chiropractors and you may experience 20 different treatment approaches. And to me, that's kind of the art in the artistic ability and kind of delivering the treatment, right? I mean, some are more effective than others, but there is an art to it. That's a good question. I mean, you get to be your own boss. You get to be, if you have your own practice, you can make your own hours. You can dress how you want to dress. Like you see me in this hat and this flannel. This is often what I wear to work. And we flip on whatever music we want to play. So, that may or may not be surprising to you, but you don't necessarily, if you're a doctor in your own private practice, have to look like a doctor. So my advice to someone considering pursuing chiropractic or something similar to this health field would be shadow, like go in and knock on some doors, make some calls, and actually try to have a time or two where you actually get in the office of somebody and see what they're doing. Like that's the best advice I can give, just because of my experience and how it really helped form what I ended up doing. And research like the ins and outs of the profession. Obviously, the internet will allow you to do a lot of that, but there's nothing like hands-on experience in doing face-to-face shadow or internship or whatever you want to call it. That would be my advice.